Good evening. It is April 15th if you're watching us live. I'm Liz Krueger, State Senator from Manhattan, the 28th District. And tonight we're having a town hall discussion about New York City. What can we do after getting a COVID-19 vaccination? I know that some of you have been with me almost through a year's worth of these, where we continue to try to educate you about the best information we have with the smartest experts that can be found on different issues related to COVID. And so tonight, it's actually very exciting to be participating in a discussion about life when you have the vaccine. And we have an extraordinary presenter tonight, Dr. Celine Gounder. Before we get to her, I just want to go through some of the basics we always start with. One, of course, to welcome you all. If you're watching on Zoom or on Facebook or are calling into the town hall discussion today, I want to remind you that we have set up closed captioning on Zoom and Facebook. So as a viewer, you have to activate the closed captioning to view the text on your device. If you're in Zoom, click on live transcript in the meeting controls to start viewing closed captioning. If you're on Facebook Live, you will see a setting button in the bottom right-hand corner of the video. Click closed caption, CC, to start viewing closed captioning. And we hear back from people how valuable it is to have this option, even if you think you hear okay, but not great. So it can help to reinforce when you're reading and hearing something. Next, before we begin, let's go over some basic vaccine updates because they change every day in our city and state. Following the recommendations of the FDA and the CDC, and out of an abundance of caution, New York State and New York City have decided to pause with the administration of the Johnson & Johnson vaccine. That was the one-shot vaccine. This demonstrates that the safety monitoring system is working. These occurrences, very rare, of blood clots were reported and are being investigated. There have been 6 cases in 6.8 million people who have been vaccinated with the J&J vaccine. So please, if that was the vaccine that you've taken so far, do not start to panic. Do not worry. It is statistically not a problem for you, but we want to be extra cautious because we always want to be extra cautious, which is why you're not going to be able to get it until they've checked out some things. So again, the CDC, the New York State Health Department, the New York City Health Department advise people already vaccinated with Johnson & Johnson. If it has been within 3 to 4 weeks of getting vaccinated and you've experienced severe headaches, abdominal pain, shortness of breath, or leg calf pain, you should speak with your doctor. It looks like this pause will last for at least a week. During that time, no homebound vaccinations will be administered, and the J&J vaccine will not be used at any community vaccine sites. We'll see what happens after that. The good news is that there's an increasing number of vaccination appointments available at pharmacies and at city and state-run vaccine sites for the 2 other vaccines, the Pfizer vaccine and the Moderna vaccine. They are both 2-shot vaccines, but they are more and more accessible. If you do not have an appointment yet, please schedule one. The vaccine prevents severe illness, hospitalization, and death. They really have a lot of evidence now, as you will hear more about how valuable these vaccines are to us all. And now we will move to tonight's event, again titled New York City, What Can We Do After Getting the COVID-19 Vaccination or Vaccinations? You should know that the event is being recorded. Everyone who RSVP'd for tonight's event will receive an email to the link to the video shortly, because you might want to watch it again and you might want to share with others that they can watch it. All right, an overview of this evening's event. Now that we have COVID-19 vaccines available, there appears to be a light at the end of the tunnel. However, we live in a densely populated city where variants are rapidly spreading and COVID-19 cases are still rising. The White House COVID-19 response team recently emphasized the importance of continuing to follow safety precautions and the dangers of reopening too quickly. So now that many New Yorkers are asking, what is it safe to do after getting vaccinated, and what are the implications for reopening the city? The virtual town hall is featuring Dr. Celine Gounder, an infectious disease specialist and an epidemiologist at NYU's Grossman School of Medicine and Bellevue Hospital. She's also a CNN medical analyst and a former Biden transition COVID advisor. I just want to say all these amazing doctors who went into infectious disease and epidemiology never imagined they would be the rock stars of our time. And this year, they really are becoming our rock stars. Dr. Gounder is also the CEO of Just Human Productions, a nonprofit organization dedicated to using the power of narrative to make public health concepts more accessible. We could all use that. Dr. Gounder will share information during this town hall about the impact of COVID-19 vaccines on contracting and transmitting the virus, COVID-19 variants, we hear about those every day, public health, and reopening of the city, as well as what activities are reasonable to resume post-vaccination. After her presentation, I'll be moderating a Q&A portion of the town hall. Many of you have submitted questions already. We probably have more than we're going to be able to get to, but you will still have the ability, if you're on Facebook, to be able to type in additional questions that perhaps we will be able to get to. I guess you could do that on Zoom also. So if you have additional questions as the doctor is speaking, type them in. We'll see how many we can get to. And get Dr. Gounder, thank you so much for being with us tonight.
Thank you, Senator Krueger, and it's a pleasure to be here with all of you tonight. I just want to start off by saying, you know what, New York has done an amazing job over the course of this pandemic. We really have banded together, done the right thing, did the things that we needed to do, including the masking and laying low for a while, and then later when we had tests available, getting tested, and now that we have vaccines available, getting vaccinated. And so I think it's really a testament to that tough New Yorker spirit that we are surviving this, that we are thriving through this, and that we will get on the other side of this. I think it would be helpful to go through some of the latest news, because the news for COVID is constantly shifting and changing. And it really has been a crash course in the science of this virus over the last year. So, you know, for all of us, we're having to really drink through a fire hose as we try to keep up with all of this, the news and the science. The big news over the last couple of days is really around the Johnson & Johnson vaccine. So what we have picked up on, and this is through the vaccine adverse events reporting system, what we call VAERS, is this signal that there is perhaps an increased risk of this very rare kind of blood clot that you can get in your head, which can cause a stroke. Very rarely are we seeing this maybe in association with the Johnson & Johnson vaccine. And so it's not even clear, is it being caused by the vaccine? And you know, how often is this happening? We have picked up 6 of these cases among about 1 million younger women who have received the vaccine. There does not appear to be an increased risk for men or for people over the age of 50. And so I think it made a lot of sense for the FDA, the CDC, to say, hey, let's step back, let's just put a pause on this and look at the data and evaluate. The vaccine has not been taken off the market. If a provider wants to give the vaccine, they actually still can. It was really more about saying, let's look at what's happening and also alert healthcare providers about this risk, because if I have a patient who comes to me and says they have certain symptoms, I need to know what to look for as a doctor. I need to know how to treat this as a doctor, or, as any other kind of healthcare provider. So what should you be looking for? If you got the Johnson & Johnson vaccine and within the first day to 3 days afterwards, you have some side effects, headache, fever, those kinds of things are normal. Those are side effects we see with all the vaccines. The window that really concerns us is 1 to 2 weeks after getting the Johnson & Johnson vaccine. And I'll say that one more time, 1 to 2 weeks after getting the Johnson & Johnson vaccine, if you have a headache, if you have shortness of breath, if you have abdominal pain or leg pain, you could potentially have a blood clot. And the group at risk is women, adult women between the ages of 18 and 50. So it's really for that group of women ages 18 to 50 who have those symptoms of headache, shortness of breath, abdominal pain, or leg pain, who got the Johnson & Johnson vaccine 1 to 2 weeks ago, in that window of 1 to 2 weeks ago, not before, not after, that we worry about this particular side effect. So in that very specific subgroup, if somebody has a side effect, they should absolutely talk to their doctor about it, let them know that they had the Johnson & Johnson vaccine, because from my perspective as the doctor, the treatment we normally reach for to treat blood clots is a drug called heparin. And that drug can actually, in this context, make things worse. And one of the very rare deaths among the very rare people who've had these blood clots was related to then having that clot treated with heparin. So it's really important that we treat it correctly if and when it happens, very rarely. Moving forward, the CDC's ACIP, which is the Advisory Committee on Immunization Practices, they are the ones that evaluate, how do you move forward given what's happened. And they've decided to wait a little bit longer before resuming or recommending that we resume vaccination with the Johnson & Johnson vaccine. I predict, and there's no such thing as a perfect crystal ball, but my prediction is that in a week or 10 days or so, when they meet again, that they will resume vaccination for most people. I think the one group where it remains a bit up in the air, will they recommend restarting vaccinations in younger women? And I think that remains to be seen. But to put this in context, there are many other things that increase the risk of blood clots, including those very rare blood clots in the head. Pregnancy, for example, is 400 times more risky than getting the Johnson & Johnson vaccine. And I don't think people fully appreciate how risky pregnancy is, frankly, for the health of a mom. And that's a tremendous public service that women do to their families, to society, taking on that risk. But it is 400 times more risky for getting one of these blood clots in your head, getting pregnant, than it is to get the Johnson & Johnson vaccine. Birth control pills are lower risk, but still higher risks than the Johnson & Johnson vaccine. So these are risks that we as women take on every day. And if you compare that with the risk of getting COVID itself, your risk of having a blood clot, if you get COVID, end up in the hospital with COVID, is 1 in 5, 20%. So that's a much, much higher risk. And I think if you look at the trade-offs, even in younger women, you're much better off getting vaccinated with one of the vaccines than with getting COVID. And then, it really comes down to which of the vaccines do you prefer. For some people, the idea of one and done is still really attractive. And I do think that there is something to be said for people being able to make a personal decision about some of this and deciding how much risk they want to take on. The good news is that we have plenty of the Pfizer and Moderna vaccines to vaccinate all of our adults in this country by the end of May. And so supply of vaccine is really not going to be a problem here. So I think that's all very encouraging. The other big news, to really evolving news, I should say, is around the variants. So what are variants? These are mutants of the original strain of the SARS-CoV-2 virus. The three main variants that we worry about are the B.1.1.7 variant that was first detected in the UK, the B.1.351 variant that was first detected in South Africa, and the P.1 variant that was first detected in Brazil. We also have this homegrown variant that was first detected here in New York City called the B.1.526. Now, what we're seeing is the B.1.1.7 is now, this is the UK variant, and I'll just refer to them by location for simplicity's sake moving forward, but the UK variant has become the dominant strain in the US. So you really have, in a sense, two overlapping epidemics. You have the original spread of the original virus, which has been on the decline, and then you have on top of that the rise of the UK variant. And so it's been a little bit hard to tease them apart up until recently. The UK variant is the dominant variant here in New York City, as it is in the rest of the country. And it's important because it is more infectious. That means it spreads more easily from person to person. The B.1.526 variant, which is the New York City homegrown variant, is the second most important variant in New York City now. And that variant is also more transmissible, spreads more easily from person to person. And so quite frankly, I'm surprised we haven't had more of an increase in cases here in New York, because we have these two very infectious variants here. But I think it speaks to the fact that people are still doing what they need to do with the masking and not socializing indoors too much and that sort of thing. And those things really do work. And people are stepping up to get vaccinated, and that also really does work. The other two variants that are of concern, as I mentioned, are the South African and Brazil variants. Those are concerning because the immunity you have after natural infection with the original strain does not protect you fully against those two strains, the South African and Brazil strains. And so both in those countries, as well as where we've seen a rise of those strains elsewhere, we are seeing an increase in people who are getting infected again. And this is also concerning with respect to the vaccines, because the vaccines provide much more reliable, long-term, stronger, robust immunity than does natural infection for most people, which is one reason, you know, some people think, oh, well, natural infection is better. That's not correct at all. It's the reverse. Vaccination provides you with far more reliable immunity. But in the case of these variants, so far the vaccines protect against the variants, but if they continue to mutate, then we might find ourselves in a place where they could evolve to a place where the vaccines do not protect against the variants. And so you may have heard on the news today that the head of Pfizer, Dr. Bourla, had said that we're probably looking at needing a third dose of the Pfizer vaccine, and really that applies also to the Moderna vaccine. We're probably looking at booster doses of any vaccine that you get come the fall or winter, because the virus is continuing to spread. When it spreads, it mutates, and when it mutates, it evolves, and it evolves to evade our defenses, whether that's our natural defenses or the vaccine. And unfortunately, we are seeing the virus spread dramatically in many parts of the world right now. Brazil has a huge outbreak. India, which had done pretty well early on, is now suffering a huge increase. The European countries have had to implement strict lockdowns because they've seen such a big increase related to the UK variant. And so we anticipate that as long as there are parts of the world where people are not vaccinated, where the virus continues to spread, that the virus will continue to mutate and evolve. And so, you know, this is an argument for paying attention to what's happening in the rest of the world, helping them get people vaccinated. And then also just trying to stay ahead of the virus, anticipating what might happen. We can't predict with certainty all of these details, but at least having a sense of, okay, here's what might happen. How can we prepare for that? And then finally, the last thing I want to cover before we jump into questions, because I know you have many, is around when are we done vaccinating, or how long is it going to take, or when does life go back to normal? And I think people are really frustrated. I mean, I'm exhausted. I'm sure you are exhausted. We're angry, we're tired, we're afraid, we're sad, we're in pain. We've lost a lot, whether it's losing family or patients or businesses or our livelihood. This past year has been really hard. And I think it's really important to acknowledge all of that. It's really hard also to give everyone a timeline on how long it's going to take. Because that really depends on each and every one of us. How long does it take for us to all step up and get vaccinated? Do we keep masking and doing those other things in the meantime? And that really depends on human behavior, all of our behavior. That is the most unpredictable part in all of this. And I just really hope that we can really stick it out and do what needs to be done so we can get on the other side of this that much sooner.
Well, thank you so much, Doctor. That was a really great overview of where we are now. And you're right, we have a huge number of questions, and I think more have come in. I didn't even look at the new ones yet. So let's start with some of the questions we had already prepared for you. What are the issues involved? Oh, now I think you've really answered all the questions about the Johnson & Johnson vaccine and the blood clots and who were vaccinated. There was a question about, is the AstraZeneca issues, are they related? And I'm not sure, we don't really have that vaccine here, do we?
So the AstraZeneca vaccine has not yet been submitted to the FDA for emergency use authorization. There are some similarities between the AstraZeneca vaccine and the Johnson & Johnson vaccine. They make use of the same technology, as do, by the way, the Russian Sputnik vaccine and the Chinese CanSino vaccine. So there are multiple vaccines out there using that same technology. We have not heard yet of these complications or side effects with the Russian or Chinese vaccine. They may not be monitoring as closely as we are here in the United States and in Europe. So it's possible that they are having the same issues. And it's really important to figure this out, because we need to figure out, is this a risk that is specifically associated with this particular vaccine technology?
Right.
We do anticipate that AstraZeneca will submit its vaccine data for emergency use authorization in the United States. I don't know that we'll ever use it or need it, but I think it's really important, at least for the rest of the world, that the vaccine's data is reviewed thoroughly.
So I know you touched on this, but this is such a common question among all of us. So once I get vaccinated, I'm pretty unlikely to get COVID-19. And you talked about the variants and what we have to watch for, but am I still able to spread it to other people if I've already been vaccinated?
Yeah, so the way I think about this, I'll give you an analogy. Think of vaccination kind of like a raincoat and an umbrella. And if you're in a regular thunderstorm, that will keep you dry. But if you are in a hurricane, it won't keep you dry. And right now, the level of virus transmission in the community is still hurricane level. It's not regular thunderstorm level yet. And so what that means is that even if you're vaccinated, because there's so much virus out there, even if you have immunity, that doesn't fully protect you. And so there is still the risk that you could be a carrier for the virus in that situation and spread it to others. It's very unlikely that you're going to get sick in that situation. It's really about protecting others until they have the same fortune to get vaccinated themselves. There was a report today of some 5,000 to 6,000 people who have had infections after vaccination. But remember, hundreds of millions of people have been vaccinated now. So that's like less than, 1 in 100 kind of situation where it's a tiny number of people who are ending up with infections. Most of those infections are very mild after vaccination. We're really counseling, continue to wear a mask and do those other things even after you've been vaccinated until the overall level of virus in the community comes down to protect other people.
Right. And I think it is really important to assure people that even though there's still some chance that they could get COVID after being vaccinated, as you just said, the mildness of the case is dramatically different than if you didn't get vaccinated. Because I've heard a few people say, well, why bother? You could get it anyway. And I just want to go, no, 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 you're not listening correctly. You really want to get it both to protect others. And frankly, the difference between getting the kind of COVID where you end up in the hospital in the ICU and potentially don't get to come home again versus a version where you sort of feel like you're achy and a bit flu-like for a day or two, that's a huge difference, right?
No, I think that's a really important point to make. You know, ending up in the hospital in the ICU, I don't think people fully also understand and appreciate how long it can take to recover. You know, some patients end up with a tracheostomy, for example, which is where we have to put the tube here because they've been on a ventilator for so long. We put it through their throat. They end up on a ventilator for months where we're slowly having to take them off. They become very weak from being in bed for that long. And then there's a whole period of rehabilitation for months. I mean, there's so many different things that can go wrong when you get that sick. And so having a very mild case, trust me, having something that's the equivalent of the common cold versus ending up in the hospital, that is a huge difference. And it is well worth getting vaccinated to minimize your risk of hospitalization and severe complications.
Exactly. And are we doing trials and clinical trials and studies at the same time as we're busy trying to get everyone in the world vaccinated so that we're going to have more information about the efficacy of the vaccines and how long they're protecting us for and whether and when we might need to do booster shots, either because the variation has become such that you just need a change of the mix or whether this wears off after a certain time. Do we have to wait a while before we get to do any of that, or is that happening at the same time?
Yeah, those studies are ongoing. So it was recently announced that the mRNA vaccine, so like Pfizer and Moderna, the immunity you get from vaccination lasts at least, and to be clear, at least 6 months. We can't say beyond that because that's how long we have data for. And so as we have more time, we'll be able to say, in a month, we'll be able to say it's 7 months, in a month after that, maybe it's 8 months. But we can only say at least up until now. And so the immunity seems to last quite a long time, to be durable. And there are other things that we continue to study. Pfizer just submitted their data on kids 12 and up to the FDA for review. Hopefully that will get emergency use authorization before too long as well, so that adolescents can start to get vaccinated. The pharmaceutical companies are now looking at kids under 12 and their vaccines in that group. And so that hopefully will have some data by this fall, winter, and perhaps can start vaccinating those younger kids later in the winter and next year, early next year. So, we're trying, everyone is working as fast as they can, but it does take time to study these things and to figure it out.
Right. And we've started to hear more about the value of the vaccine for younger and younger adults heading into, children. A lot of the people who watch this town hall tend to be on the older scale. So are there anything we should know about as far as the effectiveness of the vaccines for people, say, who are 85 years up, 85 and up? Is there a reason that people with underlying health conditions should or shouldn't take the vaccine? And to be honest, if you've hit 85, you've got some underlying condition. You've also got pretty good, longevity. but are there things older people need to especially be aware of?
Yeah, so we know older people, people with chronic medical conditions are the groups at highest risk for complications from COVID. So if you are in one of those groups and you have not yet gotten vaccinated, I would strongly recommend you get vaccinated as soon as possible, because that is going to be your best protection against hospitalization, against death. People who are older tend to have weaker immune systems, but that said, the vaccines seem to work quite well in that population as well. So there really is no reason not to get vaccinated. There's only upside for that group in particular.
Right. So we talked about the Johnson & Johnson vaccine, the relatively small risks, but nonetheless something to be watching for carefully. Are there specific common types of side effects that people might experience after getting other kinds of vaccinations? And are we supposed to be more concerned about some of them and do something if we think that's the side effect we're experiencing?
Yeah, and I think it's important to understand that when you get vaccinated, the vaccine doesn't work right away. It's sort of like you mix up flour and butter and milk and eggs to make a cake. And that's not a cake you can eat right away. You have to put it in the oven and leave it to bake in the oven. Similarly, after a vaccination, you could sort of think about that's popping the cake in the oven. You don't have an immune reaction yet. It takes about 2 weeks to really develop an immune reaction here. And so, sorry, I'm trying to remember where I was going with this. Your original question, forgive me.
Certain kinds of, are there specific kinds of side effects
right.
be especially careful about? Or
yeah, so those side effects are really the sign that your immune system sees the vaccine, is responding to the vaccine, kind of like what's happening when the cake is in the oven baking. That's why you're having those side effects. And so those common side effects include headache, fever, chills, some pain at the site where you got the vaccine, maybe a little muscle ache or joint pain. But these are still pretty mild symptoms. Usually within 2 days or so, people feel better. It's really the day after vaccination when those symptoms are most significant. And really, those are much milder symptoms than what it looks like to get COVID itself.
Okay, so now we're going to get into this whole list of post-vaccination activity questions that apparently people are chomping at the bit to hear from you. Because we all want to go back to just normal life now that we've been vaccinated. I'm 3 weeks past my second vaccination. So can I go to my friend's house and have a meal with them and take my mask off? Let's say, if the 4 of us, my husband and I and our closest friends, are all vaccinated, is there any reason that we shouldn't be able to sit in our dining room together and have a meal?
So if the 4 of you, 2 couples, are all vaccinated, I think it would be fine to sit indoors and have a meal. I think the big picture thing people have to understand is that vaccines work best at a population level, which means that as many people as possible get vaccinated. That actually has sort of this synergistic additive effect, where it is that much more effective than if one person here and there gets vaccinated. And so, yes, you can have that dinner, the 4 of you who've all been vaccinated, but I think this also speaks to try to get encourage your friends to get vaccinated, because it's going to make it that much easier for all of you collectively, for all of us in our communities, to get back to these normal activities.
Right. And if for some reason I was vaccinated really early, and so now it's been even 3 or 4 months since I've been vaccinated, is there any reason for me to not still feel confident that the vaccination is still working for me and to continue as a vaccinated person?
No, there's no reason to worry about that. Even if you're one of the first to be vaccinated, all of the data that we have so far is that up until now, people who were vaccinated in the beginning remain immune. And again, we only have data for as long as we've been looking at this. So vaccines started to be rolled out in December. We're now in April. That's pretty much as long as we have data for. But everything points to, yes, people are still immune. And so you consider yourself still vaccinated.
Got it. And I know lots of us are discussing, when is it safe to go back to the workplace? Some of us don't get choices, we get told. But for example, in my own office, we were discussing what the right protocol should be for us returning to the office if we've all been vaccinated. Do we still want to follow social distancing rules? Should we still be wearing masks in the office? Is there a population density issue of, that it's smarter to not have more than X number of people in a room? What do you recommend?
I think a lot of this depends on how can you ensure that everybody has been vaccinated. And, this is going to be a challenge in the coming months. You're going to see these vaccine credentials, vaccine certificates arise. New York State is actually the first state to have something like this called the New York Excelsior Pass. You can download it to your phone. It allows you to pull in the results of your vaccination or testing. And so the idea is that you could use both. So let's say you have not been vaccinated or don't want to be vaccinated for some reason, as long as you can present the results of a test within the last day or so that show you're negative, you still get sort of that free pass to enter whatever that space is. So I think you're going to see more of this across the country. It is not the same thing as a vaccination mandate, to be very clear. And it's really just sort of like an easy pass where you get to enter a space more quickly. And but if you don't want that easy pass because maybe you think the police is going to track you with it, you can still go to the old-fashioned toll booth and pay cash. And I think you're going to have sort of that system arising in many places where you can choose, I'm going to get vaccinated, I'm going to get myself tested and show the results, or maybe I'm going to be required to be tested when I come into work or come into, whatever sports or entertainment venue and show that I'm not infectious. So there is going to be a bit of a hybrid there. And I think it will really depend on the particular workplace, particular business, how they want to approach this. I think in healthcare settings, we're going to be one of the strictest. And in my, where I work, not only are we really encouraging people to get vaccinated, but everybody's still wearing masks. We wear N95 masks whenever we're seeing any patient right now, regardless of whether they have COVID or not. And so, I do think it depends a little bit on the workplace. Do I think if everyone in the workplace were vaccinated, could you go back to work in person? I think you could, as long as there's a way of making sure that's the case. I think that's the big question is how can you ensure that everyone is vaccinated?
And a lot of people are still very concerned about getting back on public transportation, on our subways, on our buses, on the trains. One, is there a reason to be extra concerned if, again, you've been vaccinated, you're following, stay 6 feet away, masks, but then also a sub-universe? Is there a reason that immune compromised people should feel more concerned about public transportation once they've been vaccinated? I mean, were they more worried before COVID? I'm not sure that they were, but maybe they were. So help us understand if we think we're totally healthy and we've been vaccinated, or if we think we're immune compromised and we've been vaccinated.
So if you're totally healthy, you've been vaccinated, you can absolutely go back and use public transportation. I would still recommend wearing a mask and doing some of those other things right now, just because there is still so much virus circulating out there. And it's really because you don't want to pick it up and be a carrier and passing it on to other people. Your own personal risk in that situation is very low. With respect to people who are immunocompromised, not all immunocompromised people are consistently responding to the vaccines. And so that is a group where I would be a little bit more careful. One option is to ask your doctor for testing to see if you've developed antibodies after getting vaccinated. So some of the people for whom, this might be a concern are people who are on very strong immunosuppressive drugs. For example, people who have had an organ transplant. But that's a pretty small percentage of people.
Yeah.
And I think there are ways to sort of address that for that group. Talk to your doctor, they can help walk you through that. But for most people, once you've been vaccinated, just continue wearing the mask. You can absolutely go back to public transportation.
Okay, thank you. So, in a work situation, you probably can figure out who's been vaccinated or not, and your boss can ask, or, you can all ask each other and check. But what about some of these other activities that, some of us are dying to get back to, but we don't want to die because we got back to them. So how about visiting museums where you're not going to know the universe of people surrounding you?
So I think visiting museums you can do as long as you're wearing a mask. My understanding is many are still limiting the numbers of people who could go in at any one time. And so as long as they are limiting the numbers, keeping the density low, and you are still wearing a mask, I think it is okay to go back to visiting museums.
Okay. So I had gotten into some controversy compared to some of my colleagues over the last several months, because when they kept saying, okay, we're allowing indoor dining again and we're allowing more people there, I was like, no, you take your mask off, you're chewing, you're spitting, you're coughing. The research shows the ventilation systems are shooting the germs around all over the restaurant. Some people thought I was overreacting and was hostile to restaurants. I'm not hostile to restaurants. I just didn't want more people to get sick. Can I shut up now and go home? Can people go to indoor restaurants and not listen to me tell them, bring the food home in instead?
Yeah, so unfortunately, restaurants, bars, and gyms are by far the riskiest places you can be indoors. And so me personally, I have been vaccinated. I was among the first to get vaccinated because I'm a frontline healthcare worker.
Right.
So I got my first dose back in December. I have yet to go back to indoor dining. And it's because, again, there's still so much virus in the community. That's not safe. And I was very opposed to some of Governor Cuomo's moves to really reopen indoor dining. I know there's a lot of pressure, economic pressure to do so. And I think the way you address that is, for example, some of the measures that are in the new administration's American Rescue Plan, which is to support small businesses so they can remain closed to indoor activities and not go under. And I think it's really important to help those folks survive this, survive from a both health perspective and a business perspective. But I think that's one of the very last things I would suggest going back to is the indoor dining, the indoor bars, and indoor gyms.
Thanks. I'm glad you said what you did, because I'm feeling a little bit more, okay, people gave me some crap, but I stood my ground saying what you've been saying now for months and months. So thank you for reaffirming that I've been trying to give the right advice, and it doesn't mean I'm anti-restaurant, or God knows I love to go out for a good meal if I can, but not now for like a year. What about things like a swimming pool, a gym, a fitness class? Is it okay to do those things? Obviously, you won't really know who else is there, who's just been there on the piece of equipment right before you, et cetera, et cetera.
So I think anything indoors of that nature is also very high risk. And so I would really steer people away from indoor exercise as well. I think classes, especially where you have multiple people in the same room, it's very hard to make that safe. To the degree that you can do anything outdoors, virtually, we've been working with my husband and I, same personal trainer for years. And she's just worked with her clients over Skype or Zoom. And, there are a lot of gyms that are offering virtual workouts online right now. It could even be a group virtual class. And so I think there are alternatives in this moment that are reasonable and that are safe.
Right. And in fact, we did a town hall on virtual classes for exercise, et cetera. And people can probably still find it on my Facebook if they want to. How about dental appointments, medical appointments, haircutting appointments, all those things that we maybe just haven't gotten around to for a year?
Yeah, that was actually one of the first things I did after I was vaccinated. I waited 3 weeks after my second dose. And you really should wait a minimum of 2 weeks after your second dose of Pfizer or Moderna, and ideally 4 weeks after Johnson & Johnson before you can consider yourself fully immune. First thing I did was go to the dentist. And those are places that really do have the beefed up ventilation and some of those other things in place to keep everyone safe. They're medically regulated and required to do some of these things. And so if you want to go to the dentist, if you have a doctor's appointment you've been putting off for a while, absolutely. Once you are out of that window where you're waiting for your immune system to gear up after vaccination, and again, that would be 2 weeks after Pfizer, the second dose of Pfizer and Moderna, 4 weeks after your dose of Johnson & Johnson. At that point, feel free, go see your doctor, go see your dentist.
Great. So play dates for children. So this is an example, this I'm sure is a very real example. I'm fully vaccinated. Is it safe for my 2-year-old to have an indoor play date with another 2-year-old whose parents are fully vaccinated, but they go to work? I'm still working remotely. What are all these intergenerational rules of how we can function together?
Yeah, I think this one's a bit of a gray area where it really depends on people's.
We lose you? Hello?
We have lost her for the moment.
Oh dear. Are we all on, just not her, or is the whole thing down?
It appears to be still going.
Okay, so hi everyone. We've just lost our guest for the moment. Let's see if we can bring her back for some more questions. So we'll just see if she pops back in. This is one of the challenges of live town halls. And while we're still waiting and hoping that she's able to rejoin us, I just want to point out something that I think we did put up in chat, but is important. If you've been vaccinated, do you still need to get tested? And the New York City Health Department advises COVID-19 testing continues to be important even after you get vaccinated. Testing is so important because it helps to break the chain of transmission. It informs what the infection rate is in New York City, and it allows us to understand what variants are present and how quickly they are spreading. So, like vaccinations, which used to be very hard to get, and testing was very hard to get, it's not hard at all to get tested now. And they're asking people to try to get regularly tested on a monthly basis. Certainly get tested if they feel like they have any COVID-19 symptoms, and also get tested if they're going to go visit someone who they believe is at risk of severe illness. So even though you've been vaccinated and you're feeling confident, maybe before you go visit your 93-year-old grandmother, it wouldn't be terrible to get tested. And so you could, before you show up, say, not to worry, vaccinated, tested, this is going to be fine.
And Dr. Gounder is back.
Oh, perfect. Good, because I was running out of
computer. My computer pooped out on me. Apologize for that.
That's okay.
But I agree with what you just said. Visiting your 93-year-old grandmother, even if you've been vaccinated, great idea to get tested, especially with somebody like that who is so high risk.
I'm so glad you're back because my ad-libbing can get very strange when people are actually thinking they're tuning in to listen to a professional. All right, so we covered actually the 93-year-old grandmother safely visiting her grandchildren. And again, so if the adults are vaccinated, if everybody's testing. Now, we don't test children. Do we test children? I don't know.
We do.
Okay.
And that's right. That was the question I was answering. So if you have two families,
Right.
two parents,
2-year-olds, yep.
Yeah, yep. And so I think that really comes down to your own personal sense of risk. It is very rare for young children to have severe COVID, but it does happen. And there have been kids who have died from COVID. It is very rare. So I think that's one of those where it really just comes down to, are you the kind of person who just doesn't want to have any chance of my child getting this and having a severe complication? Or are you somebody who, can live with a bit of risk? And that's, I think, a personal call.
So for people who have young teens, so they're not quite in the category that we're vaccinating yet, but so everybody's vaccinated except, say, the 14-year-old who already had COVID, it turns out. This is a real question from someone, and will not be vaccinated until it's approved for the 14-year-old age group. So the rest of us fully vaccinated. Is it okay to be together as a family unit? I mean, who's at risk in this kind of situation?
So I guess it depends what is the family unit. I think that is a situation where I think of it as the household bubble, who lives in that household together. Kids, teenagers are really, from the perspective of COVID, they are adults from that perspective. And so their risk of getting infected, of passing on the infection to others is very real. And just because they had COVID before does not mean that they're going to have strong immunity or long-lasting immunity. What we seem to be seeing, and there's some trends, but it's hard to say exactly in any one person. It would seem the milder the case of COVID you had, the less immune you will be afterwards, the less strong of an immune response. And so because many younger people who've had COVID have had very mild cases, our concern is many of them will not have very strong immune responses to protect them against another infection. And so I would consider them adults who are not vaccinated yet. And I think within your household bubble, you socialize normally. It's really a question of how do you protect against people outside the bubble. And so this is a situation where you have to say to yourself, okay, people in my bubble are not vaccinated, I might be. And so I really do need to keep wearing a mask and doing everything I can to protect other people in my bubble until they have that protection.
So today was cold and rainy, but we've already experienced a couple of really beautiful days here in New York City, I think hitting 70. And so when that weather happens, we know what happens. Everybody rushes to the parks. And particularly now where we've been trapped inside forever, physically and mentally separated from nature and other people. So young people are going to rush to the parks, and they're going to lie on blankets, and they're going to gather with their friends, and it'll be 6 and 7 and 8 and 9 of them, and they won't be 6 feet apart on those blankets. How worried should we be, since at least they're going to be outdoors, and maybe they'll wear their masks, and maybe all of them will be vaccinated. We wouldn't know because it's just piles of people spread out all over Central Park for me. That's my district.
Yeah, so your risk is much, much, much lower if you're outdoors. To get COVID, to transmit to others, I would say if you're going to be within less than 6 feet from each other, I would still wear a mask, even if you're outdoors. But otherwise, I think if you're socializing outdoors, that's one of the safest, that's really the safest way to socialize with other people. So by all means, go to the park, just still bring along that mask so that if you are close, enough to other people within 6 feet, that you are wearing that mask.
Right. So some of us, probably most of us nowadays, have family who's not just here in New York, they're farther away and we haven't seen them and we really miss them and we want to get together. So we could get on a train or a plane. And are there special things we should remember if we're doing that? And then how do you feel about staying at hotels when you get to the other point?
So honestly, what worries me most about travel is not what you're doing while you're in transit, while you're traveling. It's more what happens on the other end. And so the real questions to ask are the people who I'm going to go visit, who I'm going to see and spend time with, are they vaccinated? If not, are they testing? And what are you going to be doing when you're with them? Are you going to be spending time with them indoors or outdoors? Are you going to be masking? If you're indoors, do you have some way to improve ventilation and, propping open all the windows and all the doors, that sort of thing. And so to me, that is the riskiest part in all of this. That said, when you are in transit, whether that's a plane or train or whatever it is, to be wearing a mask. Eye covering is helpful too. It could just be your glasses, but we have seen that eye covering is protective as well. And I would really try to avoid eating and drinking on a plane or in any other, whether it's bus or train or whatever, because that does require you to take off your mask. And so plan your meals around that travel so that you don't have to be taking off your mask when you're around other people in that context.
Got it. And when I asked about other appointments earlier, I don't think I heard the answer on. So we've yes, dentists and doctors. What about a barber? What about getting your nails done? Is that just decadence at this point and challenging the gods, or is it okay to do that too?
Barber's a little tougher because again, you have to take off your mask. If it's your haircut or nails, and you've been vaccinated and you're wearing a mask, I think it is fine to go back and do those things. I think seeing a barber for a shave, a close shave would not be a great idea still.
How about massage, as long as I've gone down this road?
Yeah, so I suppose it would be okay if you have been vaccinated, they have been vaccinated, and they're wearing a mask. Ideally, you as the client would also be wearing a mask, and ideally they would also have ventilation in that space. I will say, and this is a reflection of my own, risk threshold, I suppose. I have not had a massage since before the pandemic, and really, miss that kind of indulgence every now and then. And that's not something I will be doing myself for a while yet. I just think it's still too risky. And, if there's a place that could offer it outdoors, I would have a very different feeling about it, but that's not what most massage parlors are like, or most spas are like.
Right. So this is what you do for a living, but so you have a friend, you have a family member, you have a coworker, and they're not getting vaccinated and they're coming up with their reasons why. And yet, and you've been vaccinated, how important it is for them, but you also know how important it is for you not to have exposure to people who aren't vaccinated. How do you talk to them about this?
I start with, first of all, show that you care. And I would say you don't start with the vaccination conversation. Like you really just show that you care. Then you move into really listening. Where are they coming from? Why are they worried? Where were they getting their information from? Just spend a lot of time asking questions, what we call active listening, where you show that you're hearing what they're saying, that you're acknowledging that. And then with permission, maybe offer information. But sometimes this can take multiple conversations over time. This doesn't all happen in a 15-minute doctor's visit by any means. And or even over, a conversation with a friend over an hour. And so I think it's really about being patient and hearing people out. Very often this has very much to do with people not feeling like they are being listened to, that they're being heard, that their concerns are being acknowledged. And so once you have really spent the time doing all of that, it's a lot easier to at least have real channels of communication open. And then to do so in a non-judgmental way. And again, patience, I think is so important.
All right. So I completely forgot about this topic, and there was a question. So remember they were doing blood tests for whether you had COVID and testing how strong your antibodies were, and then they were asking people to donate blood that might be used as a treatment. Is any of that real? Are people still being asked to donate blood? Is there actually something useful to come of that path?
Yeah, so this is convalescent plasma. The studies have shown that there's really no benefit from convalescent plasma. I think the problem is that you don't have enough of the very specific antibody for it to make a difference in that setting. I think you just have too many antibodies for too many different things when you get a unit of blood from somebody or a unit of their plasma. There are these monoclonal antibodies that are synthesized in the lab, which are really a highly purified, concentrated version of convalescent plasma, where you're just making the couple antibodies or one or two antibodies that are very specific to SARS-CoV-2, and you're doing so in a very highly concentrated, purified way. And because it is concentrated, it's stronger. Because it's more purified, you don't have as many risks and side effects. So the data on that is pretty good in very specific groups. So people who are high risk for severe disease and who have been recently exposed, but have not yet gotten really sick. So say it's that 93-year-old grandmother in a nursing home who is exposed to COVID, but hasn't gotten sick yet. That would be the ideal candidate for monoclonal antibodies.
Got it. Thank you. So masks. So they were telling us wear 2 masks or wear an N95 mask. Now, is that still the case even after you've been vaccinated, that you're still recommending 2 masks or the medical mask? Because some people really have trouble getting enough oxygen through the 2 mask situation.
Yeah, and I understand it's not the most pleasant thing. I mean, when I go into work, I wear an N95 for 12 hours at a time. So I get it. I understand what it's like, but it's still a lot better than ending up on a ventilator. So if you have been vaccinated, I think just wearing a regular cloth mask or surgical mask is probably okay. I would say if you have not yet been vaccinated, the double masking or an N95 mask really is the better protection, especially as we've seen the B117 UK variant become the dominant strain in the United States. It is more infectious, significantly more infectious, spreading more easily from person to person. So having that double mask or the N95 really does give you that extra level of protection, at least until you can get yourself vaccinated.
And I don't even know that we were ever telling anyone this, but someone asked about it. Advice on whether people should change their clothes once they've been out in public, or even shower when they get home after they've been out in public and hence don't know whether they have been near others who might or might not have been vaccinated?
So it's always a good idea to wash your hands after you've been out in public.
Yes.
That's one of the first things I do when I get home. But I think in terms of those other things, we've learned a lot about the virus over the past year. We were worried in the beginning that this was something that was spread through direct contact. So for example, hand-to-hand contact or hand-to-surface contact. And we were also very concerned about droplet spread, which are those, like if you sneeze or you cough and you can kind of see those droplets in the air, those drop to the ground within 6 feet, which is why we've been recommending that 6 feet. what we've realized over time is that aerosols, which are like here I'm talking, you don't see anything coming out of my mouth, but there is a very fine mist that is coming out. And it's tiny, tiny bits of respiratory secretions and air mixed with whatever virus might be in there. That aerosol travels farther, floats in the air for longer. And we think the bulk of the transmission of SARS-CoV-2 is probably through those aerosols, which means that things like wearing a mask and having really good ventilation are by far the most important things you can do to prevent infection, other than, vaccination as well, obviously. Droplets are probably a factor, but not as much as aerosols. And the contact, hand-to-hand contact or surface contact seems to be a pretty minor factor here. So I think, all of the attention that we've put on disinfecting services was probably a bit of overkill. And, when I would come back home from the hospital in the beginning, I would I would take off my clothes, put them in the washing machine and take a shower first thing every time I came home. And I think we don't quite need to be as careful with some of that as we were in the very beginning before we knew.
Got it. So this is clearly a compliment to you. We have a participant who wants to know whether they can see you as their private doctor.
I no longer see patients in clinic. I only see patients in the hospital, which means you have to be sick enough to be admitted to the hospital and happen to end up on my service. So I hope for your sake that doesn't happen and you don't need to see me, but I don't take patients by appointment anymore.
Thank you. And this is a new one on me also. Apparently there's something called sniffer dogs trained to detect COVID-19, and they've been employed with excellent results in other countries. How come we haven't heard about this here in New York, since we have such a huge population and so much space to cover? And they're referencing a public medicine NCBI report showing that these dogs' sensitivity to the test was as high as 86%, was as high as 86%, and its specificity was 92.9% for being able to evaluate whether there was COVID. Have you heard anything about this?
Yeah, and just to comment actually on those numbers to start, those are pretty good numbers, but they're not as good as even the home test kits that were recently given authorization by the FDA. So they're not a replacement for some of the things that we have now. Yes, there is data on using dogs, for example, for COVID, for other infections like C. difficile, for cancer, for Parkinson's. And it has to do with the sort of a unique fingerprint in the chemicals you're giving off when you have one of these conditions that the dogs can be trained to pick up on. The problem is to train the number of dogs to do this. It's a huge undertaking. And so to be able to do this at a population level is not a small thing. Where I have seen it sort of piloted and being studied on a small scale is in places like airports. But it's just not practical at a population level. I think what you would really want to do is figure out what is that sort of odor fingerprint, chemical fingerprint that the dogs are picking up on. And then is there a way to create sort of a, what we call it, an electronic nose, sort of a machine that would pick up on that same fingerprint that you could put mass produce and put in many different places. It's just not practical to do it with dogs.
That makes total sense. Well, we have actually gotten to the end of our scheduled event. I want to thank you, Dr. Gounder, for giving us so much of your time and expertise. And I have to say, it's really like, no matter, you're a no stumper. You can't stump this doctor. She knows her stuff. And I really do appreciate your joining us. I want to remind everyone that our next event will be held on Thursday, April 22nd. That's a morning event from 10 a.m. to 11:15 event. This event is part of our senior roundtable series on being mortal, and it is titled Living Well, What Do We Value Most? This event will feature Rabbi Angela Buchdahl, who's my rabbi from Central Synagogue and an amazing person, and Jeannie Blaustein, founding board chair of Reimagine End of Life. I know it seems a little dark, especially after we're coming off this great discussion about how we're all surviving COVID now, but actually, you know, the life is a cycle and we do all eventually come to death. And I'm a strong believer in preparing as much as we can for that. So I hope people will check in on that one. And finally, we're not out of the woods yet. So again, we know there's several variants of the virus spreading in New York City. We want to make sure we do wear our 2 masks or an N95 mask. We want to keep social distance. We want to wash our hands frequently. We want to follow all the smart COVID safety practices. We commit to getting vaccinated if we're listening and we haven't done it yet, and anything we can do to help anyone around us get vaccinated. And my office, as always, is there and wants to help you with any of these situations. So I hope you have a lovely rest of your evening. And again, Dr. Gounder, thank you so much for participating with us tonight. See you at the next one.